Francis, how are you doing today?
Well, doing pretty good. A little tired at the end of the day.
Yeah? I hear you were having some trouble.
As far as what?
Well, you had told me something about your stomach. The nurse was mentioning about you had some cramps.
Yeah, well, I go ahead and have problem with some constipation because of the medicines I take. So every other day I have to take something to help correct it.
Oh, so tell me more about that.
Well, because of the back pain, I have what they call chronic constipation or opioid-induced constipation. So I have to go ahead and take Movantik every other day to go ahead and help correct it.
So, what do you think gives you that type of pain?
Well, I have compression and stenosis in my lumbar spine down to S1, and that causes pain in the lower back, for which I have to go ahead and take the opioids, which I take morphine 15 milligrams 3 times a day. Then I take Lortabs 10 milligrams 4 times a day.
So, tell me a little bit more about how long you've been using this medication.
Well, it's been a couple of years, and I'm looking forward to the point to where I won't have to take it anymore. I have surgery scheduled for the 8th of May of this year, and I'm hoping that takes care of the back pain and I can get rid of some of these pain medicines.
Well, you don't want to be taking that stuff. People who do drugs use that.
Well, actually, they are drugs, and that's the problem. One of the problems they have now in this country is the use of these opioid medications, and for people that have chronic pain, and for like myself, the chronic back pain, if I don't take something, I really can't function.
So, it sounds like a pretty drastic pain that you feel almost all the time, huh?
It's consistent every day, and if I don't take the medicines on a regular basis, I pay the price. And then if I do take the medicines, I pay the price as well. So it's like, which is worse, taking the medications and paying the price of the constipation, or going ahead and not taking the medications and paying the price of the back pain?
So let me just make sure I'm understanding this right. Without the medications, you don't seem to really function right throughout your day.
I can't function at all. As a matter of fact, I wouldn't be able to go to work. I wouldn't be able to do anything else. I can't move without something to take care of the back pain.
So, how are you preparing for dealing with this pain other than just taking the medication?
Well, that's why I have the surgery set up. The surgery is set for May 8th. They're talking about doing laminectomy, fusion. Hopefully, if we can get rid of that back pain, then I can go ahead and no longer have the need for medication. If I can get rid of the medications, then I get rid of the side effect profile as well.
Why do you think surgery is needed when the medication takes care of what you're feeling as far as pain?
Well, the medication somewhat takes care of the pain, but the side effect of the medication is also a problem. So if we can do the surgery and get rid of the pain, we therefore get rid of the medication, the side effects as well. I've already gone through the physical therapy, the injections into the spine, all of which I've done, none of which have been a sustainable relief. So therefore, surgery's been the last result.
Sounds like a pretty drastic thing to be doing, huh?
Well, actually, surgery should be more of a drastic thing. It's not your first choice. You should go ahead and do as much as you can to alleviate the pain, and surgery should be your last choice. And in this case, this is where I'm at.
So, how are you feeling about going into surgery and being under the knife?
Well, I mean, it's always a scary thing because what they tell you is the fact that there could be consequences to go ahead, or complications to the surgery, which could include bleeding into the area, and as a worse result, you could be paralyzed.
So, what do you think you should be expecting after the surgery is done?
Well, actually, I'm expecting the fact that the pain is resolved and I can no longer have to rely on these medications and the side effects that are part of it.
How are you preparing for the surgery?
Well, mentally, I'm trying to go ahead and look at the fact that I'm on the medications. I have to take the Movantik every other day, which has its own side effect, which is cramping, nausea, and the diarrhea. And so every other day, due to the fact that I'm taking opioids, I have to make myself sick and feel horrible. And I'm hoping that after the surgery, this no longer is a problem.
It won't be easy, but I can say it seems like you've definitely found some strength and ways to cope with all this.
Well, we're hoping. We don't know for sure, and you never know for sure. Whenever they go ahead and tell you about surgery, they're looking at outcomes, but they don't know for sure if this is going to take care of your problem. The fact that we've already exhausted all the other alternatives, there really isn't another choice other than going forward with the surgery.
Do you have any feelings as far as approaching the cut down of medication that you've been using?
Well, we've tried cutting down the medications on numerous attempts to where we go ahead and try to cut down to a minimal dose, but then the problems are are the fact that the pain and the problems that come in with not taking medications become exhausted.
So, would you say that you're looking forward to this surgery and possibly getting off all this?
Well, that's complicated in the fact that yes, I do look forward to the surgery and possibly having no more back pain and not have to take medications. But at the same time, I feel a cautiousness in the fact that there can be complications. It's not a 100% sure, and there can be things that can be involved to be worse the situation that I have right now.
I think you're right. Well, do you think that as time goes on, the pain may come back after the surgery?
Well, I've been told that before, and a lot of times when you look at back surgery, people say about half the time it was the best thing I did, half the time they say it was the worst thing I could ever do, and so it's the unsurety that this is going to be the answer to the problems. But when you get down to the end and you've exhausted all other alternatives, there's nothing else you can do and hope for the best.
So, how would you plan on basically correcting any pain that comes back after the surgery?
Well, that's we're going to have to go ahead and look at and see how much pain it is, and if I'm going to have to go back to some of the things that I'm doing right now. So once the surgery's been performed and the correction has been completed, we'll have to see if there is pain, what actually exacerbates the pain, and what I'll have to do at that time. But again, that's something we'll just have to face at the time.
Well, I think that you have a good outlook. I would agree with what you're saying, and let's see how things go. But thank you very much, Mr. Newsel, and I think the doctor will be in to see you now.
Okay,
I
thank you very
appreciate
much.
it.
Appreciate it.